According to the World Health Organization, every baby born should undergo screening for both hearing and vision. In developed countries, about 1 per thousand live births are diagnosed of hearing impairment. Routine international screening is accepted and performed in most developed countries. About 6 per thousand live births in sub-Saharan Africa are affected by hearing impairment from birth, which is actually 6 times higher than that reported in developed countries. Despite this high rate, routine screening of hearing and vision is not being performed for all babies born, and babies arrive to medical attention late at about 14 years. The higher incidence in sub-Saharan Africa may be explained by the ineffective maternal screening for infectious diseases, the high incidence of neonatal meningitis, and use of antibiotics in the neonatal period. Early identification and intervention with hearing augmentation within 6 months of age prevents the detrimental impact on speech and language development, as well as on the subsequent psychological and mental development. Likewise, while the prevalence of childhood blindness is decreasing worldwide with an estimate of about 0.01 to 0.041% in Europe, the prevalence is shown to be increasing in sub-Saharan Africa, with startling figures and countries like Cameroon registering a prevalence of about 1.2%. Causes of childhood blindness range from avoidable causes like corneal scarring, secondary to vitamin A deficiency and congenital cataract, trachoma, glaucoma, and retinopathy or prematurity. Shomea is a non-profit making association managed expertly by a team of adequately trained volunteering medical doctors and funded by its members, free will donors, and philanthropists. The activities of this organization focus on projects in low to middle income countries in which neonatal screening of hearing and vision are not routine and are not met with the level of expertise required to deal with these common pathologies. As a matter of fact, this association holds the interest of people living with disabilities at heart. Our approach: we will start by elaborating nationwide education program on hearing and visual impairment. Secondly, elaborate and implement proper screening campaigns followed by appropriate rehabilitation schemes. This will entail collaboration with international organizations, relevant governmental bodies, local healthcare services, and training of volunteers and members in fields directly related to the goal. Our first target population is Cameroon, followed by other third world countries. Families are not aware of the existence of neither of such facilities nor of its importance. This lack of screening for both hearing and vision is due to the shortage of medical experts equipped to manage cases identified from such screenings, coupled with economic and technical constraints. But the burden of these disabilities outweighs the cost of early identification and rehabilitation. People living with disabilities are often marginalized and disrespected in communities in which they live. More so, they do not have equal opportunities at education, healthcare services, and career. At Shomea, we have as motto to listen to the cries of the marginalized. We aim at promoting early diagnosis and rehabilitation, and in so doing, influencing policymakers.